Michigan's Medicaid work requirements. A cautionary tale. Imagine a scenario where politicians believe that implementing work requirements for Medicaid recipients will motivate able-bodied individuals to find employment. But here's where it gets controversial. Michigan attempted this approach a few years ago, and the results were far from ideal. Robert Gordon, who was tasked with establishing these regulations, now vehemently opposes them. He warns that other states are poised to repeat Michigan's mistakes, facing significant challenges they might not anticipate. Michigan Public's Kate Wells delves into this issue, providing insights from someone directly involved in the policy's implementation. Gordon's experience highlights the complexities and potential pitfalls of such measures. For instance, he points out that many individuals receiving Medicaid assistance face substantial barriers to employment, including lack of transportation, childcare responsibilities, and health issues that aren't immediately addressed by work requirements. Moreover, the policy can have unintended consequences, such as pushing people into poverty tracks, where earning more money leads to a loss of benefits. This paradoxical situation discourages recipients from improving their financial standing through legitimate means. And this is the part most people miss: the human impact. Stories of families struggling to make ends meet despite their best efforts illustrate how these policies can exacerbate existing social inequalities. By focusing solely on work requirements without considering the broader context, policymakers risk alienating those they aim to help. So what do you think? Should states implement work requirements for Medicaid, or is there a better way to support both employment and essential healthcare services? Share your thoughts in the comments below. Myth busted! How the One Big Beautiful Bill strengthens Medicaid, boosts workforce. Here's the hard truth. The One Big Beautiful Bill doesn't weaken Medicaid. It actually strengthens it. Let me explain why. Earlier this year, President Trump called on Congress to create a bill that would jumpstart the American economy and put his domestic policy goals into action. The result? The One Big Beautiful Bill, signed into law on July 4th, 2025. This sweeping legislation provides tax relief for families, secures our borders, bolsters military readiness, unleashes American energy, and here's the controversial part: reforms Medicaid in a way that truly helps the most vulnerable. As chairman of the House Committee on Energy and Commerce, I was tasked with finding $880 billion in savings from our jurisdiction. The final bill actually achieved over $1 trillion in savings by cutting wasteful spending, eliminating abusive Green New Deal regs, and promoting American energy independence. But here's where it gets heated. My colleagues across the aisle claim this bill harms Kentucky families and cripples Medicaid. They couldn't be more wrong. Let's break down the facts. Will single mothers, children, seniors, and disabled people lose healthcare access? No. The bill ensures our most vulnerable keep getting the support they need. It strengthens Medicaid by removing deceased recipients, conducting eligibility checks, and enacting reasonable work requirements for able-bodied adults choosing not to work. It even expands access to home and community-based services for low-income seniors and disabled individuals. Are work requirements just a trick to kick people off Medicaid? Hardly. The non-partisan CBO found 4.8 million able-bodied adults on Medicaid choose not to work, spending 184 hours a month watching TV and socializing. The bill simply asks they work, train, study or volunteer 20 hours a week to receive benefits. And there are plenty of exemptions. I think most people agree that's pretty reasonable. Will this bill really cause over 35 Kentucky hospitals to close? Nope. That claim is a wild mischaracterization based on a list of hospitals with high Medicaid funding, or a few years of losses. It ignores the bill's $50 billion Rural Health Transformation Program to support rural providers. If anything, this will help our most at-risk hospitals keep serving their communities. The bottom line: by cutting red tape and encouraging people to re-enter the workforce, this bill refocuses Medicaid on the truly needy. With the program's unsustainable growth, these reforms are vital to preserving the safety net for future generations. The One Big Beautiful Bill is a win-win that strengthens Medicaid for the most vulnerable. I'm proud to have played a part in making it happen. What do you think? Did we get this right? Or are there other angles we're missing? I want to hear your thoughts in the comments. New Medicaid work requirements. What you need to know. Medicaid's new work rules are forcing states into a policy straitjacket. Here's why it matters. When former President Trump signed legislation imposing nationwide work requirements for certain Medicaid recipients in August 2025, he may have unintentionally handcuffed 14 states actively crafting their own versions of this policy. This seismic shift has created a bureaucratic tug-of-war between state innovation and federal standardization, and the stakes for healthcare access couldn't be higher. Georgia currently stands alone as the only state enforcing Medicaid work mandates. But others like Arkansas and Arizona have spent years battling legal hurdles and presidential administrations to implement their visions. Here's the twist. While these states now scramble to align with Trump's federal baseline, set to take effect in late 2026, some are pushing boundaries that could redefine healthcare eligibility for millions. The core conflict: state creativity versus federal control. All proposals share one non-negotiable. Adults deemed able to work must prove they're clocking 80+ monthly hours at jobs, schools, or training programs to keep coverage. Exemptions exist for groups like medically frail individuals and parents of young children. But here's where it gets controversial. States are testing how far they can bend these rules. Take South Dakota. In July 2025, officials abandoned their planned application after realizing their more lenient requirements wouldn't survive under the stricter federal law. Why draft rules that'll just get rejected? Asked a state official, calling early efforts an exercise in futility. Now, contrast this with Arkansas. Their pending proposal eliminates all exemptions, a move harsher than federal standards. Meanwhile, Arizona wants to cap lifetime Medicaid benefits at 5 years for able-bodied adults, a concept absent from Trump's law. This isn't just about work. It's about permanently reshaping safety nets, argues health policy expert Tara Sklar, who predicts legal fireworks if such plans advance. The great unknown: will federal officials play ball? States use demonstration waivers, essentially policy lab experiments, to customize Medicaid. But with the US Department of Health and Human Services, HHS, still decoding how to enforce Trump's law, uncertainty reigns. The statute sets both the floor and ceiling, warns George Washington University's Sarah Rosenbaum, suggesting little wiggle room. Consider Montana's bold move. After reviving Medicaid expansion covering 76,000+ residents, they proposed exemptions for homeless individuals and domestic violence survivors. Republican State Senator Gail Lammers defends this as essential to local needs. Montanans are independent. Our solutions should reflect that. But here's the catch. Will federal enforcers agree these tweaks stay within bounds? The Georgia wildcard, a pioneer now backpedaling. In an ironic twist, Georgia, the only state with active work rules, wants to reduce its paperwork burden. Their Pathways to Coverage program, set to expire September 2025, originally required monthly employment verification. Now they seek annual check-ins, less strict than their own past rules and the federal 6-month standard. We're in limbo, admits a state spokesperson. Highlighting the confusion sweeping state capitals. The billion-dollar question: who gets final say? As HHS races to publish implementation guidelines by June 2026, states like South Carolina are gambling with partial expansions. Their proposal blends Medicaid growth with work mandates, a risky move in one of 10 states that previously rejected Affordable Care Act expansions. Governor Henry McMaster calls it a state-specific solution, but critics see a contradiction. Can you expand coverage while adding new hoops to jump through? Food for thought. Where should lines be drawn? Supporters argue work requirements promote responsibility and protect resources for the truly needy. Opponents counter that they create bureaucratic minefields for vulnerable populations. Consider a single parent working gig jobs. Will irregular hours or lost paperwork cost them healthcare? And what about states adding lifetime limits or zero exemptions? As Elizabeth Hinton of KFF notes, some believe there's no flexibility here, but with 14 states testing boundaries, the real battle is just beginning. Will the federal government become a strict referee or allow state experimentation? More importantly, should it? Your turn. Where do you stand? Is standardizing Medicaid rules across states fair, or does it stifle needed local innovation? Should lifetime benefit caps like Arizona's exist? And crucially, do work requirements help taxpayers or harm the working poor? Sound off below. This debate affects us all.